Hey everybody, it's Dr. Diane. Welcome back to my channel. We're talking today about peptides and peptide therapy with treating things like Lyme disease and mold illness. And this question's been coming up more and more in my practice, and I want to tell you a little bit about what I've seen. So there's a lot of different peptides out there. You'll read about things like TB4, for example, BPC 157. And I have to tell you, even though I read research on certain peptides being phenomenal, and I find that it doesn't always translate well to clinical practice when it comes to Lyme and mold. So of all the peptides out there, the ones that I've seen to do the best job, the ones that I've been most impressed with for this community are one, a combination of CJC 1295 with ipamorelin. These are growth hormone releasing, growth hormone stimulating peptides. So these two peptides work synergistically, where ipamorelin will help with this kind of faster release of growth hormone, and the peptide CJC 1295 will give kind of this more sustained release of growth hormone. So with this, what you're doing is you're increasing the natural growth hormone release in your body. And this can help with a wide variety of things. We see cognitive balance with this and improvement. We see things like improvement with muscle growth. We see improvements with rehealing tissues. But one of the things also I've been excited about with growth hormone is the improvement in pain. And oftentimes with pain, right, we're trying to get to that root cause, which in many scenarios is Lyme disease, is mold illness, is other chronic hidden toxins and infections. And yet we want to have a Band-Aid because it takes a long time to heal from these other things. And when you're in pain, I know well from my own past with pain and Lyme and mold, it's all consuming. It's mentally exhausting. It just takes over every ounce of your body and your energy. So and we want to, of course, also avoid a lot of these pharmaceutical painkillers, which are, if they're things like opioids, they're obviously addictive and can cause a lot of problems. And if they're not opioid, well, then we have problems with NSAIDs and the impact on the gut and the problems with that NSAIDs can do to the health of the gastrointestinal tract. So that's why trying something like the peptide CJC 1295 and ipamorelin can be a really helpful thing, because not only have I seen it help with pain, but it can actually help with tissue repair. Now, I've seen for most people, they still do need to get to that root, right? So this is not going to take the place of needing to move out of a moldy home, get into a mold-free place, get the mold out of your body and all those things. But it can help sometimes serve as a more healthy and useful Band-Aid while we're getting to that root. And then the other big peptide I wanted to mention is KPV. So before I talk about KPV, I want to make sure you remember that you can get free information on some of the missing root lab tests that you might have if you go to getwellquiz.com. I'm going to put that in the show notes. Remember that if you go to getwellquiz.com, the purpose of taking that quiz is to give you insight into some of your top root causes of Lyme, mold, and other things, of your symptoms. And it'll spit out some tests so that you know that, oh, if you haven't had these tests run, here's other tests you should talk to your doctor about that could be related to your symptoms. So I do encourage you to go take my free quiz. Again, I'll put that in the show notes at getwellquiz.com. Now, KPV, like I said, so KPV is a peptide that has been shown that I've seen major amazing results in working with sensitive people. So if there's histamine intolerance, if there's MCAS, if there's any of these signs of high histamine in the body, which in many people is a hyperreactivity to supplements, then I have seen KPV work very, very, very well to lower that activity or lower that reactivity. And for many people, what I've seen is when they use KPV, that then they can later start adding in supplements or medications that they were previously sensitive to. Now, of course, if you are in the sensitive group, you do always want to start with extremely low doses of anything, even a peptide like KPV. But I have seen it turn down that mast cell activation scenario that can be so severe in many people. So those are the best two peptides I've seen. You'll read online, for example, about so much study around BPC 157. And I've used it some, and some people I have found that it can reduce the inflammation, like almost like this swelling feeling, this inflamed feeling in their gut. So I have seen some people get results from it. I've just been a little underwhelmed clinically because I haven't seen the results from a standpoint of research looks so great around this and you read so much online. And so it seems when you're online, like this could be like a game changer so much of the time. And it's really just been a small portion of the time that I have seen it help. I have seen it help some people, so I don't want to discourage you from trying it, but just that I went into when I first started using peptides, like thinking like, oh, these are going to be like amazing changers for my patients. And it's only been a small percentage of the time that I've really seen, significant improvements. And like I said, some of the, times I'm talking about here are really where I've seen the best clinical improvement. So I hope that helps. Hope that gets your brain going on this. Go take my quiz, getwellquiz.com. I'll see you again soon.